As you may know, that the burden of non-communicable disease, including the metabolic syndrome and metabolic dysfunction-associated steatotic liver disease, is a global health concern. And talking about the metabolic dysfunction-associated liver disease is the most common chronic liver disease that affected over one-third of global population. And not only is it related to liver disease, but it's also related to cardiometabolic risk factor as well. Good morning. My name is Dr. Portsakon Danpanishkun. I'm the first year internal medicine resident in Texas Tech University Health Science Center in Lubbock, Texas. So I'm here to proudly present one of our article that will appear on Mayo Clinic Proceedings. Our study titled Metabolic Syndrome and Metabolic Dysfunction-Associated Steatotic Liver Disease in Premenopausal Women, Global Trend and Projection to 2040. This condition itself can progress into the inflammation of liver, cirrhosis, and liver cancer. So the metabolic syndrome and metabolic dysfunction-associated steatotic liver disease, the burden of this disease is not distributed eventually. Gender, regional differences, and societal risk factors have strong impact on the burden of these diseases. So talking about the gender, the elderly, they tend to have higher burden compared to young adults, and males have higher burden compared to females. So you may assume that the population that have the very low risk of developing this condition would be the premenopausal women, since they are not males and not elderly. But these premenopausal women, when they undergone the state of menopausal changes, the estrogen and also hormone and metabolic differences in the body start to be developed, and they start to getting higher risk of developing cardiovascular risk factors and also increasing the risk of developing metabolic dysfunction associated steatohepatitis, which can progress to liver cancer. So if we know the global burden of these diseases beforehand of this population, which are low risk but will be at risk in the future, it will help the policymaker to tailor the public policies against the rising wave of these diseases. So talking about this concern, we fill the gap in the literature by using the Global Burden of Disease 2019 database. It is the most comprehensive global database that exploring over 369 diseases over 204 countries and territories over the world. In this study, we focus on metabolic syndrome, including obesity, hypertension, dyslipidemia, diabetes type 2, polycystic ovarian syndrome, and MASLD, or previously known as NAFLD or non-alcoholic fatty liver disease. We interest in the premenopausal women, so we include the 15 years old to 49 years old. And we study the mortality, prevalence, and disability adjusted life year from 2010 to 19. And since we want to predict the burden in the future, we project the mortality and disability adjusted life year to 2040. And since we are interested in the different socio-economic development countries that can impact the burden of disease, we categorize the countries into 5 categories, including low, low to middle, middle, and high socio-demographic index, or SDI. So the higher the SDI is mean that the more developed countries. So our study found that the global burden of this condition is started climbing in the past decade. And almost all of the countries have growing burden of these diseases in premenopausal women. And the regions with the highest burden would be in the Eastern Mediterranean regions compared to other regions globally. And talking about the SDI difference or socio-economic differences in the burden of diseases, we found that in most of the metabolic syndromes, the burden of disease is higher in high SDI countries. But interestingly, the lower SDI countries, they generate the higher burden per prevalence. So this means that even they have lower burden, but if we understand it by per prevalence, they generated more burden per populations. And we also projected the data to 2040, and we found that the global burden of metabolic diseases is mainly driving by the obesity. So our study served as a call to action to prioritize the increased resource public health policies for the obesity and metabolic syndrome in premenopausal women. Further study that try to explore the sex-based differences need to be conducted to understand the difference between gender and also hormonal changes in premenopausal women and postmenopausal changes. And we also need to launch the public health campaign to raise the awareness of this population, even though they are at lower risk of developing the cardiovascular complication or liver-related complication. But in the future, when the estrogen decline and they enter the postmenopausal stages, the diseases would have higher burden in this population. And we need to focus on lifestyle intervention to improve nutrition and physical activity, including the medication and intervention to address the obesity, since they are the main driver of the global burden of metabolic syndrome in premenopausal women. And finally, we need to address the social, commercial, and environmental determinant of obesity and metabolic syndrome in this population. So that would be the end of my presentation. I would like to thank our co-authors, including the Mayo Clinic Proceedings that interest in publishing and disseminating of our article.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com Mayo Proceedings, or journal updates on Facebook, www.facebook.com Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.